Hi, this is Dr. Kolodenker, and today I'm going to talk to you about Achilles tendinitis, Achilles tendinosis, and the main conservative treatment options so that way the tendon feels better and there's less pain. Typically, the pain that comes from Achilles tendinitis, tendinosis will come either right at the insertional area, or it can be a little bit higher up, or sometimes even in the calf muscle up here. So what you could feel for is to see if there's any lumps in the Achilles tendon. Sometimes it can become bulbous, enlarged, tender when you squeeze it sideways. When that happens, there's definitely signs of damage to the tendon that can be visualized on MRI. With insertional Achilles pain back here, in adults on MRI, or what's even simpler is with an X-ray, you could see calcification of the tendon as it inserts in the back of the calcaneus. In kids, this is sometimes referred to as Sever's disease or calcaneal apophysitis when the pain is back here in the back of the heel from doing activities such as running, soccer, football, anything having to do with basically a significant amount of running and lack of stretching in a tight calf muscle. Treatment options for Achilles tendinitis or tendinosis typically start with conservative treatments. Stretching, I would say, is the main aspect of the therapy. So trying to gain length out of the calf muscle and out of the Achilles tendon. Wall stretches, which you could see in another video of mine. Calf stretches, night splints is a device that basically you could place to help stretch the ankle. A simple way to relieve the pain are heel lifts. So make sure you put a heel lift in both sides of the shoe. That way you don't throw off your back. But a 1/4 inch heel lift you could purchase over the counter. Put in both shoes. Avoid walking barefoot. Make sure you stay in a heel and gradually transition yourself out of the heel into a flat shoe. Physical therapy works well with eccentric exercises and strengthening. There's another video on that and how to do eccentric strengthening of the Achilles tendon. People should avoid getting cortisone injections in and around the Achilles tendon due to a high risk of rupturing the tendon. If all those treatments conservative-wise fail, there are surgical options which can help increase the length of the Achilles tendon. Multiple ways to do that. I will sometimes go around this area, make a small incision, and deepen it down. After I get to the muscle belly, I release part of the fascia, and that gives the Achilles tendon more length. Some people who have enlargement of the Achilles tendon back here, where it does look bulbous, need that debridement if conservative treatment does not work, which requires basically excising the large scarred aspect of the tendon. Some people develop something called a Haglund's deformity, which is inflammation, enlargement of the bone right in this area. And sometimes that bone needs to be resected as well. If conservative treatment is not working, I would recommend further imaging such as X-ray and MRI, talking to your doctor about the possibilities of either heel lifts, orthotics, or surgical options if everything else has been tried.